everyone. Yes, what we're discussing today is what we call the Parks for Health Toolkit, but it's also sharing on a slightly different way to engage in our perception of open spaces. Certainly, as a landscape architect for many years, we tend to see open spaces in terms of their physical identity, what they have in terms of elements, say access, pathways. But what I'm sharing now requires a different perspective, okay? Because what's behind it is how can we actually use parks for health and well-being, as well as for leisure, amenity, landscape advantage. But first of all, obviously, you'll be well aware of the general statistics of those with, well, first of all, in terms of mental health and the so-called comorbidities are linked very strongly with other non-communicative conditions, which are generally avoidable. And therefore, whilst we're speaking generally for mental health by definition, we're also have to include diabetes, heart disease, because there is a strong, and other conditions, because there's a strong link between those who have the non-communicative diseases with regard to mental illness are more likely to get comorbidities. And therefore, in terms of mindset, it's important that we view all the conditions together. Just a few stats. There's a 10 to 25 year life expectancy reduction for those with severe mental disorders. And in terms of learning disabilities, normal life expectancy for men is sort of 79, women 83. But even with mild learning disabilities, that comes down to 67, moderate disabilities 64, 59, 46. In other words, we're talking about a real impact on both the length of life and the quality of the life. And obviously these are often addressed in terms of health inequalities. And as most of you will remember, the Marmot Review, the Fair Society Healthy Lives in 2010, identified 6 specific areas where health inequalities he felt at that time had to be addressed. And obviously the young people issue and adults to maximise capacity throughout their lives is important. Creating and developing healthy and sustainable places and community fits very well within the context of this discussion, but also to strengthen the role and impact of ill health prevention. And that leads us on to the growing awareness and importance of the need for prevention rather than cure. Historically, as we know, medical interventions, you go to a doctor and he can either send you for a consultation to a consultant or he can give you a tablet. But increasingly it's becoming apparent that a lot of the conditions that people suffer from can't be treated in that way. And therefore this whole context of social prescribing is developing. And therefore when we're thinking about health and well-being in outdoor spaces, we're beginning to think of them as part of the primary prevention initiative. And certainly the government have committed 4.5 billion a year for the next 5 years to really start moving much more strongly into primary prevention. And so in terms of funding, which Stuart shared, we talked about there is funding there, but also I would raise the question, are there funding sources in terms of social prescribers, for example? Is there money in primary prevention that can come through CCGs and public health? In other words, because the money is going largely into clinical commissioning groups and public health, that is a source of funding you may want to think about if you haven't already. Talk to your social prescribers. And that links obviously with the heritage funding gives a much stronger base for integrated working for health and well-being, both in terms of mental illness and learning disabilities. So how then do we actually change our mindset? And I would suggest that a good way to look at green spaces is within the context of public health. And the main principles of considerations in public health have to do with dealing with treatments upstream, evidence-based, there must be science behind it. What is the economic case for value? What are the determinants of health? Where does health promotion play a part? And as we touched on earlier, having an understanding of the comorbidities between mental health and physical conditions. When we look at green spaces, clearly in terms of public health principles, but also primary prevention, we start thinking of placing them into the upstream scenario. So here, for example, issues upstream like poverty and social exclusion, downstream reflect themselves in mental illness. And therefore we're placing out the outdoors, parks, etc. within that primary prevention upstream scenario. The second thing, what is the evidence base? And again, that doesn't look that clear, but there's a strong link between access or lack of access to green space, social isolation, mental conditions, physical conditions as well, and they're all linked together as comorbidities. In terms of determinants of health, again, that's the what's called the Health Settlement Health Map by Barton and Grant, and it identified the factors in the environment which can affect our health in terms of people, lifestyle, community, social capital, local economy, activities, the quality of the built environment and its accessibility, which is pertinent to today, the quality of the natural environment, we've also touched on, and then the effect in terms of global ecosystem. And the green underneath the black shows how many of those are actually met in terms of outdoor spaces. Okay. They're very, very important as determinants of health from a medical point of view. And recent work by Fields and Trust demonstrate that 34.2 billion a year is contributed to well-being through the use of quality parks and spaces, and 111 million a year there, particularly on reducing GP visits. So you can say, okay, well, in terms of using the outdoors and green spaces for health, you can say, does it fit in with the principles? In terms of addressing issues upstream, yes, it does. It's there, it's available. Is there a strong medical evidence base, scientific evidence base? Yes, there is. Both in terms of cross-sectional and longitudinal studies, both quant and qual, and so there's a strong evidence base to support it. Is there an economic case? Yes, there is, and that's increasingly being demonstrated. Does it fit in terms of the context of broad determinants of health and the physical intervention, in terms of the physical environment? Clearly it does. But when we started looking at this as a landscape practice, what we found is that the gap was in this area here, detailed determinants of health and health promotion. And we started, so I went off to Liverpool University to help do the Masters in Public Health to try and understand the health perspective of green spaces. Because, you know, if you've been a landscape architect for as long as I have, your mindset is planning, space, biodiversity, sustainable drainage, woodlands, footpaths. That's how you think. That's how you're trained to think. But that wasn't giving us the answers in terms of how do we actually engage people in the natural environment from a health perspective. And so from that, a journey of 1,000 miles started. And as I say, we were already working in the context of sustainable development. Got qualified in public health, and then started identifying from the evidence base, one of the other strong principles, what are the key categories for health, and what does that look like on the ground? How would we recognise a healthy space if it leapt out and bit us somewhere? Historically, I would say for myself, no. Because we have a habit of seeing landscape within the framework that we have always seen it in. And it goes back to Rumsfeld's, there are known knowns, there are known unknowns, but this was moving into the area of unknown unknowns. In other words, because green spaces were being produced, and because generically we knew that green space was healthy, therefore by definition, this green space must be optimised for health. And that clearly wasn't the case. And the more we looked into the evidence base, and the more we actually categorised in terms of what we call primary health criteria, secondary health criteria, and then the actual landscape elements that contributed to that, the more it became clear that actually we weren't designing for health. We tended to design for some recreation, some amenity, but we were missing health in a big, big way. Unwittingly, without ill intent, but that was increasingly the case. And so we started interpreting the evidence base through a landscape lens, if you will, produced a health assessment model, and have now produced a series of outcomes, the health toolkit. And I'm delighted that 2 days ago, the Lottery and National Trust, the Parks Accelerator Fund came in, and we're grateful for that, as we're involved with Camden and Islington, assessing 168 parks with this model to really start moving this onto the ground. And that's what work with Lambeth as well. So we're grateful for your contribution.
Can be done.
So what is the overall framework? To start with, we had to place parks within a context of primary prevention. And that had to do with baseline data, which again we talked about, working with parks departments in terms of what is the current health status of their parks, looking at all the different criteria, then linking across and working with public health, planning environment, community initiatives, the NHS and employers to actually begin to pull together a holistic approach to using parks, because all those groups are committed to health and well-being. They're beginning to talk to each other, but if we can place outdoor spaces within a context that helps each of them deliver their targets, we begin to produce an integrated approach to actually optimizing outdoor spaces and its accessibility for health and well-being for the whole community. It then brings in funding at different levels, and instead of just looking to parks and funding, Islington and Camden are looking to public health, they'll be linking across to social prescribing, and you begin to get an integrated approach in terms of funding as well. Not only in terms of expertise, but also where's the money coming from. And then to be able to put together promotion initiatives, both in terms of physical changes and how you use green spaces, and then to evaluate it, and you compare the evaluation with the original baseline, both in terms of usability, how well parks are being used, how access is being improved, but also in terms of the numbers of people using it. And there's a lot of research that can go there to then evaluate that in terms of financial benefits. In terms of specifics, if you can't sleep at night and wondering what to do with your life, go onto the Health Park or Tisdall Associates website and try the free survey. And that will show you something of the functionality of how it works. Okay? And any feedback you can give us, along the lines of how brilliant it's been, that would be great. But also, in terms of full surveys, there's the audit, evaluation, and appraisal. The appraisal one is the one that brings about the most value. And that goes through the 80 elements under the categories of the details of the park, community initiatives, accessibility, mental well-being, physical activity, and environment and biodiversity. Okay? Which cross-references with an awful lot we've already spoken about today. And a lot of the issues that have been raised are already there, and some that aren't will be there, which is excellent. And by filling in this simple questionnaire and pressing the button, you then get the assessment report. And that provides you with an understanding of the background, charts which tell you what you have, what you could have, actual physical interventions, both in terms of the criteria, so you do have this, you could think about these. So if you're short on accessibility, for example, what does that represent and what does that represent? Well, those are the improvements, and these are potential new interventions, and these are listed. So it gives you a toolkit to use. What do I do in practice? The other thing is that it links also to obesity, non-communicable diseases, mental illness, and environmental risk factors, and says if these are particular targets you want to concentrate on, then these are the interventions you may want to consider. It gives you a basis for discussion with the local authority, with community groups, with funders, but because it's evidence-based and delivers practical interventions which can be costed, it gives you a very useful tool in terms of actually making changes on the ground. The multiple park analysis, if you want to assess a number of parks in a town, for example, and then link those across to things like deprivation, social exclusion, whatever it is, that will show you under each of the scale of parks and each of the different categories and in each of the wards, for example, which is what we're doing at Islington and Camden, the strength of the health status of those parks. And are we finding, and will we find, for example, that in some wards health initiatives are required? In other words, in other wards we need improvements to the actual infrastructure. And this will identify that and also say, and these are the things you can think about. And from that we'll produce an overall strategy which links across to social prescribing, public health initiatives, planning, funding sources, to give a steer to how they want to approach their parks. Bringing together all the integrated framework issues that we had before. We've talked about sensory maps. This is what you might call a health map. Whittington Park in Islington, and again identifies in the park, again with different symbols, the different areas you have for health. Getting active, community initiatives, places to rest and relax, environmental health benefits on social areas. And so what are the next steps? So that's the overview. Obviously do try the freebie. If there's anyone here who would like to talk about using the model, do get in touch with us. We'd be delighted to come and visit and chat through what your thoughts are. It's as you said, it has many facets. It can be adapted in many different ways, and it's there really as a helpful toolkit to give you the opportunity to decide what's best in your situation. To develop health strategies, multiple park analyses, celebrate what you already have. Some parks are already good, but people don't know they're good. So getting that message out is a really powerful message. Identify practical changes and interventions, what we call sort of high impact, low cost interventions. Develop community initiatives with public health, social prescribing, workplace well-being, and create a series of health maps. And then of course link across to primary prevention in terms of the overall holistic approach. Very quick overview. I'm delighted to talk more about it later. So, thank you very much.